Okay, just to be conscious of everyone's time, I think we'll get started. So can everyone hear me? Farah, can you give me the thumbs up? Okay, great. So good afternoon, everyone. My name's Shauna Spicer, and I'm the Alumni Relations and Annual Fund Officer with the Lawrence Bloomberg Faculty of Nursing. Welcome, and thank you for joining us for today's Lunch and Learn session, where we will hear from Farah Khan talking about nursing leadership from an inclusive, strategic, and collaborative perspective. Before we get started, I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Hira-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. So I'm now going to cover a few housekeeping items for today's event. Since there are so many of us, we ask that you stay muted throughout the presentation. We do welcome you to enter questions in the chat box, and there'll be a Q&A period at the end of the presentation. The session will also be recorded, so we can share it with those of us that weren't able to join today. After the event, we'll send you an email, which will include the link to the recording and an opportunity for you to provide feedback. Now it is my pleasure to introduce today's speaker. Farah is a proud Bloomberg Nursing alumna graduate from the Master of Nursing program. She has over 20 years experience in healthcare. Farah has held many leadership roles in operations, regional planning, and administration, and is currently the Senior Vice President of Patient Care Services at Trillium Health Partners. She's also an adjunct lecturer for the Lawrence Bloomberg Faculty of Nursing. Farah is a recipient of numerous awards, including the RNAO's President's Award for Leadership in Clinical Nursing Practice, the Bloomberg Nursing Teaching Assistant Award, and most recently, the Mississauga Mayor Crombie's COVID Hero Civic Award. Farah has served on numerous nursing groups and currently serves as the board member of the Canadian Nurses Association and vice chair of the Bloomberg Nursing Equity, Diversity, Inclusion, and Indigenous Committee. Thank you for joining us today, Farah. I'm going to pass it over to you.
Good afternoon, everyone. This is so humbling. And yes, I'm nervous, and I'm just really humbled to be here and to share a few minutes, some time with all of you. Hopefully, you are lunching, and I'm certainly always open to learning from all and sharing my learnings as well. So a disclaimer and recognition that while I am an adjunct faculty member of the Faculty of Nursing, I do work at Trillium Health Partners, and yes, I'm a board member with the CNA, and I have other activities that I'm involved with. Today, I'm going to share kind of my own perspective and my learnings across the many years that I've been in healthcare and a nurse. And so they're not reflective directly of the institutions or organizations that I'm affiliated with. I plan on sharing my own journey, what I've been on for the recent years, how equity, diversity, and inclusion matters and mattered to me, and maybe along the way we'll learn and share some personal strategies in my career as well. All right. So a little bit about me and my background. So some of you may be wondering how she's speaking English so well. She doesn't look like she's Canadian. Well, funny enough, many of actually even at the CNA, some of my board colleagues who are from other provinces in the country say, Farah, you're more Canadian than some of us are Canadian. I was born and raised in Malton. That plain there is, if you know of the airport area, the Malton area, I was born and raised in Canada, and I do feel more Canadian than Pakistani. My parents are from Pakistan. They came here over 50 years ago. Worked in healthcare, both of them in various roles over the years. And as immigrants, they really started as nothing, with nothing, and they worked their way through their careers. And my mom actually is a retiree of both Trillium Health Partners where I work and also Sunnybrook Health Sciences Center. And my dad worked for McKesson. And as I was growing up, I never thought about myself as being Pakistani or being from a different country. I always thought of myself as Canadian. And I'll share with you as I went through my own personal professional journey and career, I started to realize increasingly that my roots mattered, and I am just as much as a Canadian. I am a child of immigrants. So I always wanted to be a nurse. But in my culture, nursing isn't seen as a profession that it holds prestige, although I'm trying to change that. I always faced challenges with my parents because they said, nope, you have to be a doctor and nothing else. But I was inspired when I was in high school by many nurses, actually here at Trillium Health Partners, where I work in the emergency department, by the compassion and just the orchestration that the nurses did in the emerge. And I knew I wanted to be a nurse through and through. And so I did my undergrad at Humber. I was a diploma nurse, went to Ryerson and did my bachelor's, and then later did my master's at U of T. Throughout all of that, while I knew that nursing was the career that I wanted to pursue, I later realized that it's actually leadership that was my passion, and I'll share more about that as I share my journey. So a lot of us hear about leadership versus management, and many of those who are on the call may be thinking about their career and think, I don't want to be a manager. I don't want to deal with unions. I don't want to deal with conflict. I don't want to deal with jaded nurses. I hear this still, and I've heard that, and I felt like that at one point. But I knew that leadership was something that I enjoyed. I was a ward clerk before I became a nurse, and I even demonstrated my leadership through that. And I finally became a bedside nurse in the trauma program at Sunnybrook. And through that time, I explored unit councils, got involved in extra kind of activities. Quickly within my first year of becoming a nurse, I was already a preceptor, already team lead, already charge nurse. And I knew I wanted to start something different, try something different. And so I actually explored clinical instructing through U of T. And I met Maureen Berry, some of you may know, and I was clinical instructing for U of T at that time. And I had a discussion with Maureen actually and said, Maureen, I'd love to do my master's, but my marks aren't that great. And she said, don't worry about it. You have so many other things to put yourself forward with, try it. So I put myself forward, and I said, I put the complete package, and I said, look, marks aren't that great, but you know what? I know leadership is my thing. And I know excellence is my thing. And so I learned, and I explored, and I pursued that master's degree. And I kept unlocking my potential. I kept on trying to understand what are the things that I know and what are the things I don't know. What are the things I do good in and what are the things that I don't do good in. And where I saw opportunities, I sought learning to help bridge those gaps. And I followed my passion for excellence. I knew that excellence in healthcare was something that mattered to me. I really didn't know which job was next or what I needed to do. And a lot of students, if there are any on this call or anybody who's in a role right now and thinking, what next? You don't have to necessarily have that answer. You just need to know what are the things that entice you or make you happy. And so it's actually Maureen who connected me with a recruiter. And the recruiter was looking for a manager for the pre-admission and post-anesthetic units at Mount Sinai. And I took the plunge, I took a risk. I put my hat in the ring, and I never worked in those areas before, and certainly had not had a formal management role, but I took the chance, and I became the manager there at Mount Sinai in those areas for a very long number of years, and I learned incredible things. But the one thing I learned during that time is that there's a fine balance between leadership and management. And a lot of us think that management is separate from being a leader, and it wasn't. And quickly I realized over those years that increasingly leadership really mattered a lot more than just the title of being a manager. During that time, I started really uncovering and unlocking what mattered to me around equity, diversity, inclusion. I didn't even really know what equity, diversity, and inclusion were until I met the office at Mount Sinai and the people in that office. And then I started to realize that maybe the color of my skin, I should think about it more. And I'm not as Canadian to others as maybe I thought I was. And maybe the way I dress and the way I look, it may be influencing how others interact with me or perceive what I'm sharing, and also may have an indirect impact on what I'm even choosing to do and pursue in my career. I lacked confidence, or I was searching for that confidence. I felt like I was being judged, and I wasn't sure of myself. And I wasn't even sure if I was getting invited to the right tables and having access, like others had access to opportunities, to growth, to promotion. So I knew that I needed to learn more about this, but I also knew that I needed to, ask and talk to others as well. So there's an incident that really sticks in my mind, and this is when I was in my days where I had transitioned to the senior director role for surgery and oncology at Mount Sinai, and I'm so grateful for everyone I worked with along that way. And a physician leader, an executive leader, was at a table, and I went to introduce myself, and I was so nervous because I knew that he was going to put his hand out to shake mine. And I don't shake hands with males. That's a religious and cultural preference of mine. Not everyone does that, but I do. And I was so nervous, and I thought for sure this is the end of me advancing in my career or even having a seat at the table. And so I took out my hand. He took out his hand to shake mine, and I put my hand on my heart and I said, "I'm sorry, for religious and cultural reasons, I don't shake hands." And he started laughing, and he said, "You know what? My mom is Orthodox Jewish, and she doesn't shake hands either, and I should have known better." And we both started laughing, but we bonded over that, and we bonded so much over that. We did some great things together, and I learned through that example, and it really sticks in my mind that it takes time, but try to understand others, explain to others. It's okay to explain that culturally we don't shake hands, and it's okay to take the risk to have them understand you as well. And through that process, I also realized along the way that there's lots of things structurally that we do in healthcare, in our institutions, our organizations that we've established, but maybe we need to unestablish, and it takes time to unestablish that. And so I'll tell you a little bit about my trip to Ottawa last week. But in Ottawa, it was pretty normal for me not to put my hand out and for others to offer to shake it as well. So it's becoming a more common practice over the 20 years that I've had to go through this. So a lot of people ask me, "Farah, was it hard?" Yes, it was hard. There were times where I felt being judged. I felt discriminated against. I felt the effects of racism, and I do still today. But that's others, and I am me, and I can only control what I can control. Courage has been so central to me advancing in my career. I had to take courage, but I had to also listen, learn from others, accept that sometimes people will learn and listen, and sometimes they won't. And sometimes I will be successful, and sometimes I won't be successful. And so to accept failures, that's okay. It's okay to take those risks. I made space at tables where there weren't spaces for me at tables. But then I also learned to meet others and created space with others at those tables too. At the core of all that I did, I also ensured that my values, my principles, the things that are important to me in my career, like excellence in healthcare, like excellence in nursing and leadership, stayed at the core of where I went and what I did. And so in this slide, I wanted to share all the many people, and there's so many more. And I just met a whole bunch of them this week at the RNFU Gala, who've made a difference in my career. And mentorship does matter. And so along the way, as I was trying to figure myself out, I was a bedside nurse. Maureen Berry up in the top left corner, she mattered. She made time to talk to me about where I was going and what I was pursuing. Frances Flint, who was the director of nursing professional practice at Sunnybrook at that time, took time to explain to me what I wasn't understanding, maybe about how senior team worked and who was at the table. And there's so many others, including Terry Irwin, who's my current chief nursing executive at Trillium Health Partners, who have come to me and said, Farah, it's okay. We need to learn from you just as much as you're learning from us. And so mentorship matters. And to those who are in mentorship positions, don't forget how much of an impact you're making and we're making on others. And so our mentorship does matter. Annika Andel, and I don't know, Annika, if you're on the call, she's also an alumni of Bloomberg Nursing. Her and I met through U of T. There's a mentorship program at our Faculty of Nursing. And so she was in her final year of her practicum, her master's. And so we started meeting on a monthly basis, just having a chat. And she was finding herself and her career next steps. She was working in a downtown hospital in one of the departments there, and knew that she wanted to advance in leadership. And so I introduced her to a few people, and next thing you know, she's now a point of care leader in one of our neuro MSK program departments here at Trillium Health Partners. So our mentorship does matter. Mentorship matters to me a lot. So one of the things I've been able to channel or do is work with Carissa and Kama, who work with me here at Trillium Health Partners. And I see Bev and others here from the RNFU. We just recently this week won an award. It's actually the highest award that's been given for the Nurse Innovation Award through the RNFU. And so we're now developing a mentorship app at Trillium Health Partners. And so soon people could swipe left, like Tinder, to match with mentors as we think about the increasing population of internationally educated nurses, as we think about the diversity that is coming to nursing, just not only through immigration, but also through those who are like me, having courage to put themselves forward and to pursue careers in nursing or careers in leadership. And so we're developing this app and more to come on this in the future, but it's very exciting for us. Some people also ask me, Farah, so what else do you do? Well, I also am a board member with the Canadian Nurse Association, and my involvement with this board came about a year and a half ago when I started working with somebody in the CNA around PPE and the struggles that especially women who wear hijab were facing when we were in our COVID crisis and we needed to wear PPE, and the struggles from an IPAC perspective we were facing. And so I met Aiden, who's now working at the College of Nurses of Ontario, but she was working with CNA at that time. And through my connections with her, I started realizing, wow, the board of the CNA doesn't really reflect some of the people that I know and I work really closely with, and I don't see myself there. And so in that last election, then I put my hand up and said, I'd like to get involved. And so over the last year and a half, I've had the privilege of working with many of these people that you see in these pictures. And last week, we actually participated in Ottawa at the Parliament Hill Day. And so in the Parliament Hill Day, we actually meet with politicians, speak about issues facing healthcare. And so in the top left corner, you see Mark Holland, who's our Minister of Health, and with our president and CEO of CNA, and Yasu, if you know him, he's the president of the Canadian Nursing Students Association. we actually met with Mark Holland and talked about all sorts of issues facing healthcare. Health equity was one big thing that we talked about. Also talked about nursing agencies. If anyone wants to talk to me about that afterwards, we had a great talk about nursing agencies. And in the bottom right corner, you can see many faces, some of whom are alumni of our Faculty of Nursing. And you see to my immediate left in the picture, Senator Patterson. So she's a senator who was a bedside nurse in ICU in St. Catharines. And she pursued a career in the military, or sorry, in the armed forces. And she was there for quite a number of years. Last year she retired, and now she's a member of the Senate. And she's one of two, they just announced the second nurse, but she's one of two nurses in our Senate. And it was such a privilege to hear her speak, and also her talk about her journey and the tables that she needed to be on, and the diversity that wasn't at the tables, and how she brought herself, just as I did, to the tables where she wasn't invited to. And lastly, I wanted to share in the top right corner, we were staying in a hotel, and in that hotel was in the right corner, you'll see a girl with a little name tag on. Her name is Alan. And Alan is an internationally educated nurse. And I was talking to her for a couple of days. She was registering me in and out. And I just happened to say something. And she said, "Oh, how come there's so many nurses here today?" And I said, "Oh, we're here with the Canadian Nurse Association." And she said, "Oh, I'm an internationally trained nurse, but I'm working 3 jobs because I can't afford to become a registered nurse here yet. And it's so complicated." And we just ended up talking that she'd been here for 6 months. She's working 3 jobs to pay for some of the steps just to get herself registration. And it was just so humbling to meet her. And she was inspired by us, but we were all collectively so inspired by her. And so one of the other key things that I wanted to share with all is that on this equity, diversity, and inclusion journey that I've been on through my leadership and advancing in my career, a lot of people ask, Farah, how did you, remove barriers, break glass ceilings? I said collaboration. I would say collaboration was so integral. And it's integral to dismantling racism and discrimination, but it's also integral for us to come together to understand even what are some of the structural, policies, procedures, and things that we have that are our barriers to us not only advancing the profession and getting to tables that we need to be at as a profession, but also those of us who do come from racialized backgrounds, who are equity seeking. How do we also come together? And collaboration was so integral. For me, I needed to understand why we had certain policies and certain procedures. I needed to meet with all those people you saw on those in that previous slide, all those people. I needed to also understand why certain things happened, and then also share why a variety and diversity of perspectives mattered too. So the RNAO Black Nurses Task Force report has some excellent recommendations. If you haven't read that, that would be a great place to start for somebody who has not learned about some of our systemic racism and discriminatory practices that we have in the profession, as well as the Canadian Student Nurse Association has a promoting anti-racism in nursing education in Canada report, and there's many other reports. And you heard from Shauna that I am a member and co-chair of the EDIIR committee at the faculty, and these are just some ways that I'm bringing myself to learn and also bring myself to the table to really understand how do we dismantle some of the things that we have in place that are preventing us, and those who can contribute and advance us further. So I'm going to wrap up by saying this has been a journey of nursing excellence. The people that I've met have taught me a lot. But I do know that as a profession of nursing, there's fragmentation, there's silos, there's competition, there's territorialism, and we as a profession need to come together. Equity is so important from a quintuple aim perspective, but also from just a professional advancement perspective. To those who are looking for the next step in their career, there are so many places to go in nursing. and in nursing leadership, find what that point of excellence is, whether it's nursing excellence, healthcare excellence, leadership excellence, or just excellence, and learn to take those risks, and meet people along the way, network, and take those risks. So lastly, have fun. Lee and I are former colleagues from the faculty, and I do find that we take things way too seriously in healthcare. And it is worth taking seriously because we have patients and families at the core of what we do, but do not forget joy in work. And I will say why I took this picture is my brother is also a nurse. His wife is also a nurse, and he thinks I'm just his sister. And so I took this picture with Lee because he's so impressed by Lee. And I took a picture with him to say, hey, you know what? She's a buddy of mine as well. So that's for him. So thank you. I don't know if anyone's got any questions, but that's my journey. And those are my little nuggets of experiences and learnings along the way. And again, a humble thank you to everyone who has touched my career and advanced me in my thinking and in my journey along the way.
Thank you so much, Farah. That was really great. If you do have any questions, we do have time. So feel free to enter them in the chat box, or feel free to just raise your hand and unmute yourself and ask your question as well. We've got some people applauding. Beverly, go ahead.
Farah, thank you very much. That was really, really interesting and very personal. And I think the personal is often so interesting to hear for us to hear someone else's journey. So thank you for sharing all of that. I don't even know if this is a question as much as kind of a consideration. You use the word excellence a lot. And that is not really something that I'm familiar with. I've been retired for a few years and, the terminology changes, but can you kind of describe sort of what you mean by adding the word excellence to all the places where you added it? And I'm sure it should be done that way. I'm just trying to make sense of kind of where it fits or how it fits. Is it something we're aiming for, or I'll leave it to you to answer as you wish.
So Bev, it was great meeting you this week, by the way, and thank you for your question and your comments. Excellence is a word that I've created for myself. It means to me the best that I can be in whatever. Whether it's how I was doing a bed bath, I'm not joking when I say this, but it's whatever I was doing at point of care, or whether it's a meeting that I'm chairing, or whether it's a committee that I'm a member of. How can we ensure that we're doing the best that we can do and be? And I feel that from like a granular level, like I said, at the point of care, I hear it from point of care staff. I really worry about if I'm doing the right thing, and I'm always looking ahead at delivering the best care that I can possibly give. But I can see Sally over there or Bob over there who's just, doing the bare minimum. And I can see that they could have taken the extra step, but they won't. And so for me, whether it's I'm talking to point of care staff or whether I'm talking to Mark Holland, for me, it's how can we do better than what we're doing, and is it the best that we can possibly do? I have a background in quality and patient safety, and I've been fixated in quality improvement, and I don't have formal training in quality improvement, but I do know that striving for the best and better has been core to what I have done personally in my career. That's probably why you see that word everywhere, but it's not part of a new theory or framework or model for sure.
No, that's really helpful. The notion of striving. We may or may not be there, but we're striving to be better and better towards excellence, so to speak. That makes a lot of sense. Thank you.
And then there's a question in the chat that kind of adds on to that excellence piece from Chloe. How do you maintain excellence in health during a nursing shortage, burnout, and quick turnover?
It's a good question, Chloe, because I mean, no other profession, I think, has faced what we faced and continue to face during the pandemic. And it's hard. It's hard. I've had my days where, I'm tired, especially when we were doing facing our early days in the pandemic. I literally got a call on a Sunday night and was told tomorrow morning you need to have the screening up for, with your colleagues at all the entrances. And so a whole bunch of us were scrambling and we just did what we needed to do. And that whole week, I don't think I slept more than 2 hours. And it was started then and it still continues to this date. I don't think I've slowed down since then. And it's hard, but I take time for myself when I need to. I fill my cup. Chloe, there's some things, it's funny because last week I just said to Terry Irwin, our chief nurse, I said, Terry, I'm taking a few days off to go to Ottawa because I need to fill my cup. And she knew exactly what I was saying. My fill my cup was to go and talk to Mark Holland and not shake his hand and say hello and have a great conversation with him about the healthcare issues we have provincially and nationally. So my advice, Chloe, would be, yes, there's turnover, yes, there's burnout, yes, there's shortages, but what helps you fill your cup, what helps you kind of turn that off temporarily and do something else. And I do strongly encourage those who are not involved in extracurricular groups and interest groups or whatever to get involved, because that's a great way to advance where maybe you could see more quicker wins than you can in very long-standing structural challenges that we have in healthcare. The problems we have in healthcare have been magnified by the pandemic. They aren't issues, though, that completely came out just because of the pandemic.
Great, thank you. And then Rob Fraser has his hand up, so we'll and then we'll have a question from Sarah. So we'll go Rob and then Sarah from the chat.
Thank you, Farah. Always a pleasure to hear from you. And you were on my mind recently, so I'm so glad that this webinar came up because I started leading a team and one of my team members is from a diverse background that shares similar cultural values. And I was trying to think of who are leaders that I know in the healthcare that she might kind of look up to. And I'm curious for myself, what advice do you have to leaders that are managing team members with diverse cultural backgrounds, how to support them, make sure to open doors for them? We have done things like at conferences, ensuring that there's breakfasts and lunches and not just dinners where alcohol is served or things like that. So what would you recommend to leaders or wish that you saw in some of your managers in the past to help develop and open those doors for you along the way?
So good to see you too, Rob. Every time I see Rob, I know he's moved 10 steps ahead into something else and doing wonderful things. So number one, my first piece of advice is do what you just did. Ask, right? A lot of people don't ask. A lot of people don't acknowledge that there may be special things to consider. Having a team member now who has a diverse cultural background, and guess what? Maybe the person wears hijab or a turban. Maybe there's nothing for you to consider. So ask them then, right? And after asking them, then ask others. That mentorship page I showed, I also made connections. I went to others and asked them. So you can always call me. I'm a phone a friend to a lot of people, but I've got a lot of phone a friends too. It's not a secret. There's a crisis happening in the Middle East. Many of my Jewish friends and myself are being called upon, and we're calling each other to ask, is it okay if we say this or we talk about this, or if, something happens, how do we address it? The same goes with meals, alcohol, going out to a pub. Somebody asked me when I in my new days in this organization, they asked me, would it be okay to go to a pub? And my answer was, I'll go, no problem. grew up here. I had friends who drank alcohol. I just won't drink alcohol. But there's some Muslim women that don't. So you always ask, make the connections, and it's okay to ask. No one's gonna ever get upset that you've asked.
Okay, so we can go to the question from Sarah in the chat. What recommendations and tips do you have for a new grad nurse looking to advance their career in nursing leadership?
Hey, Sarah, that's a big question. I would say, as a new grad, as I shared, being a preceptor, seeking local leadership opportunities like team lead, a charge nurse. Those were great ways. Many hospitals and or organizations have councils, unit-based councils, or team interest groups. That's a great way. Lee Chapman and I actually got involved in developing a course for peri-anesthesia nursing, and how we did that. And Divya, I see that you came on. Div and I were on the Ontario Peri-Anesthesia Nurses Association. I was interested in leadership. I was a manager at that time. I joined the OPANA just to develop my leadership skills by being amongst other leaders. And so finding interest groups that are linked to your area of nursing specialty is a great start.
Great. Any other questions?
When is that app coming out?
We'll call you. We have some work to do. We have some time to do it, but we're very grateful for the RNFU, and yeah, we have to think outside of the box. And definitely DEI is core to our thinking around this app, because there are a lot of internationally educated nurses and or just nurses with diverse backgrounds who feel not so comfortable putting up their hand to say, I don't know. And a common thing I've heard nurses say is, I don't know how to do an IM. And I'm scared to tell people I don't know how to do an IM. It's something so basic. But then you layer on top of that somebody who is a visible minority, and there's not a diverse leadership group, you can feel even more intimidated.
I think Beverly has another question. Feel free to.
Yeah, it's not a question as much as a comment. I may have met some of you along the line. I did a lot of leadership development over the years. With colleagues, we ran the Dorothy Wiley Nursing Leadership Institute, which we eventually gave to CNA, and then COVID hit. I notice now that they have started a new program that looks terrific. And I just want to say that sometimes your organization will support you to go to something like that. So don't hesitate to ask. If you have something that you want to do in your organization that requires you to learn some new skills to get these things done, ask whoever you report to. I'm very interested in going to the new CNA. Look it up first and figure out what it's all about. And then ask if your organization has any opportunities to be supported for something like that. Because if you don't ask, it doesn't happen for you. It might happen for somebody else. So, and if anybody wants to be in touch and ask advice, I'm happy to do that. So people like Farah have my email, so be in touch. Thank you.
And Bev, LinkedIn is a great place to connect to. I've made lots of connections on LinkedIn, and it's been a great way. There's some people in that picture of mentors that I showed that I've never actually worked with. Judith Shamian's a great example. She's a great nursing leader, and her and I've never worked together, but I've just met her through LinkedIn, Twitter, and then I went and introduced myself. Karima Velji is another one. Karima I met through social media, and along the years, she's served as a mentor to me as well.
Awesome. All excellent advice. If no one else has any questions, then we can wrap up and save everyone 15 minutes of their day. Thank you again, Farah, for taking the time to talk to everyone today and share your experiences, given all the questions and comments. I think your talk was very well received. Oh, we have one more question or comment, and we do have time.
Oh,
Linda.
I don't have a question or comment, but I just want to say thank you to Farah. Since I met her one time, and truly she has inspired me so much, to the point where my life is changing. I am very grateful for what she does. The positive attitude that she brings, it changes life. And I just want to say how grateful I am, and I'm so happy for how the line that she's going to and how far she have come.
Okay, now Linda, I have to tell them how we met. I was doing a pressure injury audit on Linda's unit, and we bring our senior team members to shadow the nurses while we're doing our prevalence and incidence audit. And I just met Linda, and she was so passionate about pressure injury prevention. I said, Linda, why don't you get involved? And she said, well, I'm a member of the council, but I said, but get involved. She said, we should really have nurse champions across the hospital for pressure injury prevention. I said, oh my goodness, how do we not? So I connected her with our professional practice department, and now Linda is just like busting it out. She's doing awesome work. And I do have to share, our pressure injury rates have been the lowest ever in our organization. And it's through nurses like Linda who are just, and clinicians, all clinicians interprofessionally, who are just advancing excellence in clinical practice. So thanks, Linda. You're awesome.
Thank you, Farah.
Charmaine has a question or comment.
Yeah, it's a comment just to build on Linda's comment. I know Farah, we work together at Trillium Health Partners, and I want to say the energy that comes through in this teleconference is really how she is in real life. Extremely approachable. You've always had my back. You've always been there when I needed to knock on the door. A quick little email. Like, she really is a great mentor. So I would recommend anybody reaching out to her for sure.
Reach out to Charmaine too. She's a nurse practitioner who is in the space of oncology, who is doing all sorts of just wonderful things. And this is the point, I think, in a nutshell, I'm trying to make, that as a profession, we have so much to learn. Charmaine, if I may, Charmaine has Indigenous roots, and along the journey we met when I was the regional director of the regional cancer program. And she too, over the years, has just came out of her shell on these kinds of topics and has advanced the Regional Cancer Center at Credit Valley in such amazing ways. And sometimes all you need is just someone to say, it's okay, go do it. And she's done it.
Nice.
Well, okay, that's great. And I also want to add that Farah is just a tremendous and wonderful ambassador on behalf of Bloomberg Nursing as well. You definitely are a proud alumni of our faculty. So thank you as well on behalf of the faculty for speaking today. And for just being a remarkable mentor and ambassador for us as well. So thanks everyone for attending. There's such good vibes from this from this talk. And this is actually the first alumni lunch and learn that we've hosted for this year. So you set the bar very high. Our next one will be hosted in January, and so stay tuned for an invite. We will have one of our PhD students speaking about their research on the environment and healthcare. So stay tuned for an invite for that. And thank you, everyone. Enjoy the rest of your day. And thank you again, Farah.
Thank you, everyone. And I recommend some of these people who came off mic, any of them who were alumni, pick them to come talk as well. I'd love to hear their stories as well. So
yeah, and if anyone is actually, that is a great point. If anyone is interested in speaking at this alumni lunch and learn series, please get in touch with me. And I work in the advancement office at the faculty. We'd love to have any of you as mentors for our one-on-one mentorship program. And then we also host mentorship events that Farah has been involved in. So feel free to reach out, get involved in the faculty, because like Farah said, mentorship goes a long way for our students. And I'm sure you all know that as well. So yes, thank you.
All right, thanks everyone. It's been humbling. Thank you so much.